Hi everyone, this is Dr. Rufus Vasanth Raj, Senior Consultant Orthopedic Surgeon, specialized in arthroscopy, trauma, joint replacement and sports medicine. Today we are going to discuss about a very important topic, heel pain. I see a lot of patients coming to clinic from various age groups, right from young people to elderly people with heel pain. It's very common. In heel pain, we commonly look at two important factors or two important diagnoses. One is called as a plantar fasciitis, the other one is Achilles tendinitis. So let's discuss one by one. First one, plantar fasciitis. So what does it mean? Plantar fascia is basically a soft tissue or a structure found at the bottom of your foot. So basically it is connecting from the top. Basically it is attaching to the heel of the bone. So the heel bone is called as calcaneum. So many people complain of pain, especially on the heel. It's very classical that they come to me and say that early morning when we get up, we have a severe pain. We can't keep our foot on the ground, and after keeping the foot on the ground, it takes some time. We walk for a few minutes and only then we start feeling better. So this is very classical of plantar fasciitis. It also happens when people take a nap in the afternoon or any kind of rest. Sometimes I see people from IT professionals saying that we sit for long hours and once we get up, we suddenly have severe heel pain. So this plantar fasciitis, from the patient's point of view, they always come with a similar complaint. Heel pain, more after a rest. From the doctor's point of view, it's very easy to diagnose. Most of the times the diagnosis is clinical. That is, by touching the patient, by feeling certain movements, I will come to a diagnosis that it's a plantar fasciitis. Any investigations can be done? Yes. We do few investigations to rule out few things. One is a basic X-ray. So what do we see in an X-ray? We normally look for any extra bony projections called as calcaneal spurs or heel spurs. Sometimes you might have some bony overgrowths which can happen in the undersurface of your heel from the calcaneum, and that can cause some injury to the plantar fascia. This is one possible thing which we can see on an X-ray. The other thing is that sometimes we do diagnosis to rule out any arthritic things like uric acid being on the higher side. Even though uric acid very classically causes a condition called as gout and more commonly seen in the first toe, it can happen on the heel pains also. So once we come to a diagnosis, now comes the treatment part. Every doctor has a different way of treating it. I take it step by step. So the first treatment plan for me is very simple. I'll give some anti-inflammatory medications for 10 days. So these medicines help you beautifully in your acute phase. When anybody comes with severe pain, all they want is a pain relief. So this tablet will make a beautiful difference and will reduce all kinds of pain. In addition to that, I will always start on physiotherapy. Ultrasound therapy, laser therapies, shockwave therapies, TENS therapy, like that, multiple modalities are available. All these modalities usually help you to come out of pain. So medications along with physiotherapy. In addition, do I give anything? Yes, I give two kinds of thing. One thing is that I advise them to walk on a MCR or a MCP slippers. So basically, most of the patients say that I use slippers, but it's outside home. Inside home is one of the main important factors because I see a lot of housewives spending a lot of time inside home. So if you're inside home, if you're not wearing a slippers, it makes no difference. You should wear a soft cushion slippers. So these kind of slippers will help you in walking inside your home. And I also suggest some brace called as plantar fasciitis brace. So whenever we sleep, what common mistake happens is that your foot falls down. It doesn't hold. Because holding happens because of the muscles, and that those things happen only when you're awake. When the heel falls down or the foot falls down, the plantar fascia is stretched a lot. So early morning, that is the reason when you keep your foot down, you have severe pain. So I suggest night braces. They're called as dorsal splints, dorsal night splints basically. So when you are sleeping, we ask you to wear some kind of braces. These braces hold your foot in a straight position and doesn't allow you to fall. So because of that, the plantar fascia doesn't stretch. So early morning, when you get up, you can remove these braces and keep your foot on the slippers. Never walk on barefoot, especially if your house is containing of granite or hard tiles. It's always better to wear a cushion slippers. So these are the four things which I give when a patient comes to me with plantar fasciitis. That is medications along with physiotherapy, a night brace and a slippers to walk at home. Sometimes after 10 days, the patient comes back and says, no doctor, the pain is still severe, I couldn't feel much of a difference. Or the pain reduced as long as I take the medications, but as soon as I stop the medications, I again start getting the pain. In such situations, I would like to investigate further. I sometimes do an MRI scan to rule out any other abnormalities in the foot and heel. If the MRI comes normal, then we can go for injective therapies. If you look at injector therapies, there are multiple injective options. In olden days, or most of the senior doctors always give steroid injections. One shot of steroid is perfectly fine, but multiple shots are not recommended. So what does a steroid injection do? Steroid injection is nothing but it is a small dose of steroid. We inject it locally wherever you have pain. So it reduces the inflammation and makes you feel very comfortable. But unfortunately, steroid is only a local injection and also works only for a short duration of time. Multiple injections should not be given, especially one dose of steroid given. You should give a gap of minimum 6 months before giving one more shot. The other injections are currently available are the stem cell therapies, lubricant injections. Yes, they can be tried a little bit on the expensive side, but if the patient is very comfortable and if they are okay with the money factor, then stem cell therapy is far superior to a steroid injection. In addition to that, even after all these things, if the patient says, no doctor, my pain is there for 3-4 years, whatever short course we have tried with the medications, physiotherapy, braces, slippers, injections, it's not working, then final resort will be a surgical intervention. We do a plantar fasciitis release and make the patient feel very comfortable. But it's not an emergency surgery, so I would always keep surgery as the last option for plantar fasciitis. So heel pain, the most important factor which we discuss is always plantar fasciitis. Many times patients Google about it and directly come to me and say that, yes doctor, we Googled, I think it's a plantar fasciitis. Nothing wrong. I think plantar fasciitis is still the most common reason. The other important reason is called as Achilles tendinitis. So what is an Achilles tendon? You have a big calf muscles. You have big calf muscles behind your back of your leg. So these muscles, as they come down towards the heel, they become a thick strand of tissue. So that tendon is called as an Achilles tendon. It also attaches to the heel. So Achilles tendon sometimes can have multiple problems. One of the commonest thing is calcification. So calcification means extra bone formation in places where it is not supposed to form. So Achilles tendon, wherever it attaches, the lower half of the Achilles tendon can become calcified. A lot of bone depositions might happen and it can slowly make the tendon very hard and non-functional. In such situations, it is also accompanied by other conditions like retrocalcaneal bursitis and finally leading to a condition called as haggling deformity. So this Achilles tendinitis can also be very classically seen on an X-ray. As soon as we do an X-ray, we see a lot of bone depositions in unwanted places, especially in the insertion of the Achilles tendon. In such situations, again, I always tell the patient, this is a little bit more severe than a plantar fasciitis. We might need to be a little bit aggressive on these kind of conditions because they are very harmful. They prevent you from walking, they prevent you from running, and they give you a lot of pain in all possible activities. So in such situations, again, I usually start with some physiotherapy and tablets to see how the patients are doing well. If the patients are not doing well, I'll be a little bit more aggressive and give injections. At the same time, Achilles tendinitis, most of the times, if it's got a lot of calcification, it ends up in a surgical intervention. We might need to go inside, remove all the unwanted bones and close the Achilles tendon so that it gives a more solid feel. So plantar fasciitis and Achilles tendinitis are the other two common factors which are the main reasons for heel pain. Achilles tendon sometimes can have a tear. Many times we see patients, they classically say that we had a small fall, but after that we have severe pain behind the heel. And sometimes while walking, we are not very comfortable, especially climbing up steps or climbing down steps, we find it very difficult. In such situations, X-ray might not give a clear picture. MRI scan is very, very important because MRI is the only soft tissue investigation which is going to give a clear picture about the Achilles tendon tear. If Achilles tendon is torn, it always requires a repair. Sometimes it can be a partial tear. We can treat it with POP, plaster of Paris, or walker boots for minimum 6 to 8 weeks. But most of the times we encounter complete tears. In complete tears, the capacity to heal is very, very minimal because the tendon also starts retracting proximally. That is, the tendon starts retracting more towards the knee joint. So we might need to pull it down and repair it in the initial stages. In later stages, they become so contracted that we might not be able to pull it down and repair. In such situations, reconstructions and tendon transfer procedures might be required. So to avoid all those complications, whenever Achilles tendon is torn, we always advise you to have a repair. So in addition to these two common conditions like plantar fasciitis and Achilles tendinitis, we can also have multiple reasons for pain around the heel bone. For example, heel bone itself, calcaneum, can sometimes have a fracture. Calcaneal fracture usually happens because of loading. Somebody jumps from a 3rd floor or from a high falling point, you land on the heel. In such situations, heel fractures can happen. Calcaneal fractures sometimes a little bit bad, sometimes it can be very straightforward. Bad fractures are operated, straightforward fractures are usually not operated. In addition to this, fractures, tendinitis, we can also look at few more factors like because the front part of the foot can also have pain which sometimes can mimic as a calcaneal or a heel pain. The front part of the foot can have some pains called as metatarsalgia. you have metatarsal bones in the front part of the foot. So all these bones sometimes can have stress fractures because of too much of running, jogging, because nowadays we find a lot of people interested in physical activities. So they directly start running 10K and 22K half marathons, 21K half marathons. So which is not advisable. You should always start slowly and gradually increase it and finally end up with a full marathon situation. So sometimes when people try to be more aggressive, they start getting front foot pains, forefoot pains, which also can sometimes lead to back foot pains, that is the heel pains, hind foot pains, that is the calcaneal pain. In such situations, again X-rays or MRIs might be more useful. Very bad fractures can be picked up in X-ray, but minor stress fractures can be picked up only in MRI scan. When all these stress fractures are identified, it requires nothing major. We need to look at few factors. We give a plaster of Paris or a walker boot immobilization for 6 to 8 weeks. We also check their vitamin D calcium levels along with their bone mineral density. If there's any osteopenia or osteoporosis, we might need to correct it with some injective therapies and along with it, vitamin D and calcium supplements. These things can be beautifully handled in any kind of foot and heel pains. So, as I discussed so far, it's plantar fasciitis, Achilles tendinitis or Achilles tendon tear, forefoot pains like metatarsalgia. We can also sometimes have peroneus longus tendinitis, posterior tibialis tendon tendinitis. All these things are more of a clinical finding. These things do happen when patients have flat foot. See, we always understand that the mechanical problems are a little bit complicated and we need to take more effort to treat them. For example, if somebody's got a bike or car and 2 wheels are well aligned, it's very, very simple. We got 4 wheels in a car, but 1 wheel is not aligned properly. So that's something very similar to a patient. That's something which is very similar like when patients have flat foot. So flat foot is basically the arch of the foot is lost. So patients might have a different deformity. Some patients might have a simple straightforward flat foot. Some patients have turned bones, some bones protruding. All these things can sometimes lead to severe heel pains and foot pains. So these things should be taken into a careful consideration. Most of the times these problems are from birth. Patients sometimes adjust it and live with it without any complaints, but some patients are not comfortable. They have severe pains and other conditions which can complicate their life. In such situations, we do a surgical interventions. Otherwise, in general, all these flat foots are treated just conservatively with some arch support footwears and some stretching exercises. All these things generally help them to feel much better on a longer run. So any patient who's got a heel pain, always be very careful. It can be multiple factors. The Google always shows first is the plantar fasciitis. So never assume that it's a plantar fasciitis. You might also have other conditions which can be little bit severe. So always better to see a doctor, do the necessary investigations, first come to a diagnosis. As a doctor, I always tell all patients that the first step is always diagnosis. Many times patients have heel pain, they just go to a nearby pharmacy, take some medicines, keep on taking medicines. That is a very bad habit. Sometimes they don't diagnose themselves, they go to a physiotherapist, they keep on doing some physiotherapy. Again, that is very bad. We first diagnose, x-rays, investigations, whatever it is, always diagnose your condition, find out which stage of the condition you are there. Plantar fasciitis can be in early stage or late stage. Achilles tendon calcification can be in early stage or late stage. Early stage doesn't require a surgical intervention. Most of the times, late stages require surgical intervention. So, you should be very careful in handling all these situations. So, always investigate properly, come to a diagnosis. The moment you come to a diagnosis saying that, yes, this is the problem, then we plan the treatment modalities, plan the treatment protocol and beautifully take it forward and make you feel very comfortable. So, I advise everyone saying that if you have a heel pain, don't take it seriously. We come to the conclusion that all heel pains are not dangerous and heel pains can be treated 100%. So always when you have a heel pain, come to a doctor, diagnose yourself and treat yourself as early as possible. Thank you.